Welcome everyone to the 8th in a series of social service workforce webinars that are funded by PEPFAR and implemented under the auspices of the Global Social Service Workforce Alliance by USAID partner Capacity Plus. I'm Amy Vess, the coordinator of the Alliance. In today's session, we'll be talking about ways to adequately support the workforce. Often we think about this in terms of developing or strengthening systems to improve and sustain social service workforce performance, developing tools, resources, and initiatives to improve job satisfaction and retention, or supporting professional associations in their efforts to enhance the professional growth and development of the social service workforce. This last one will be the focus of our next webinar. We know for many fields and occupations, whether it's business, health, or social services, that the nature of the work environment influences worker performance and retention. In a good work environment, workers feel recognized and supported. Professional development and psychosocial well-being are priorities. Good supervision is provided, and workers can trust their peers and turn to them for support. But what are those elements that are unique to the social service work environment that make this even more critical, particularly when we look at working with children and families, and the worker's role in building relationships with families and coping with unpredictable, emotional, complex, and often ethically charged interpersonal situations? At the systems and policy level, what can be done to help support workers to do the good work they want to do? And how do we best engage workers themselves in improving the work environment? And what are some of the elements of supportive supervision, as well as peer group support, mentoring, and coaching? How can a supervisor be supported to encourage and provide space for reflection, critical thinking, and discussions about why certain situations are posing more challenges than others, or how the workers' values, biases, and experiences may be influencing family engagement? These are just some of the questions and issues our speakers will be addressing today. So let me go ahead and introduce them and walk you through our agenda. Today's session will begin with a presentation by Eileen Munro, who is a professor of social policy at the London School of Economics. She was a social worker for many years before taking up an academic career. She has studied philosophy, in particular the philosophy of science, and this has fueled her interest in the reasoning skills needed in social work. Her current research interests include how best to combine intuitive and analytical reasoning in risk assessment and decision-making in child protection, and the role of the wider organizational system in promoting or hindering good critical thinking. At the request of the Secretary of State for Education in England, she undertook a review of child protection in that country and published the final report in April 2011, followed by a progress report in May 2012. As Eileen is presenting, if any questions come to mind, feel free to type them into the chat window. We'll track the questions coming in, and then Jim McCaffrey from Capacity Plus will moderate a question and answer period after Professor Munro's presentation. We'll then move on to our second presenter today, Rita Muyambo. Rita is a team leader on a 5-year USAID PEPFAR-funded capacity building program being implemented nationally in South Africa by a consortium of partners from PATH, Health and Development Africa, and the International HIV/AIDS Alliance. Rita is employed by the International HIV/AIDS Alliance. The program focuses on improving the well-being of the social service workforce, particularly targeting community caregivers, on the premise that a well-cared-for caregiver is an effective one. Rita is responsible for the development, design, implementation, and management of the psychosocial support and supportive supervision skills-building programs. And again, after she presents, Jim will moderate any questions you have for Rita. We'll then have a discussion session where we will invite you to discuss your programs, ask questions of one another or of either of the speakers. Jim will then provide closing remarks, and I'll wrap up the session and invite you to type in any announcements you might have. So just as a reminder, before we get started, feel free to write questions or comments in the chat window throughout the webinar. We will do our best to address these questions following the presentations. Thank you very much, and I now hand the microphone over to Professor Munro.
Thank you. I'm very pleased to be here and have this opportunity to talk to you all. What I'm planning to do is to talk a little about some of the mistakes we've made in written in the hope that it may help some of you avoid following in our footsteps. But basically, we have erred in thinking that good managerial control can do a lot to improve the quality of help that children receive. And what has happened is that that element of managerial control has started to dominate, so that we've actually forgotten the equal importance of good skill in the people who actually have direct contact with the children and the family. And so what I want to outline is what we have to take account of in terms of having a service that is focused on the quality of help that is being received. So the outline is, first of all, to assert the case for the importance of organisational factors. They are never neutral. They either help the front line or they hinder them, but they're never just in the background. Secondly, then, I want to look at what type of expertise is needed, both at the level of formal knowledge and how procedures can help, but also the element of intuitive skill and emotional wisdom that's needed in working with families suffering from severe problems and with very intense emotions in the work that you do. And then finally, to look at the key supports for workers. There's been a lot of work around how workers are influenced. This is one particular triangle that was developed by David Woods, and I haven't got his name on the slide, which I should do, because otherwise it looks like plagiarism. But it is about seeing that the service, the quality of the service that actually gets experienced by the child and family is partly to do with what's going on inside the practitioner, but a great deal to do with the resources and constraints created by the organisation, and about the overall culture, the policies, the procedures, the regulations. In many ways, the overall culture is one of the most influential factors in terms of what it prioritizes. You can have an official written policy, but workers react to the unofficial policy that is actually communicated through the culture of what is important and what isn't. In the review I did of the English child protection system, this is just an example of how one of the things that was done in order to make life a lot better for child protection social workers was that the government paid for the development of a software program that was basically a case management system. It had, for different groups of children, it had 9 different forms that you completed over the sequence of processing a child through the child protection system. But it was a part of many other changes going on as well. But what ended up happening was that it was so standardized that it made it very hard for people to respond to the unique features of the child in front of them. It linked in with a performance management scheme that was focused very much on timescales rather than quality. So instead of the first part of contact being getting a decent enough understanding of the family problems to make a decision on what to do, it became completing the initial assessment form within 10 days. And it's a radically different task, as you can imagine. And one of the knock-on effects of this is that you get more and more professional dissatisfaction because they have less scope for engaging properly with families, they have less scope for using their expertise and judgment. And then you find people have a low morale. We've then suffered from big problems of people leaving the job and of experienced people not staying, so that the managers saw that the frontline was even less experienced and felt we must therefore increase the managerial control even more. So you got into a vicious cycle. And it ended up at the point when I did my review where social workers dealing with referrals for child maltreatment were spending 80% of their time in front of a computer screen, which obviously left very little time for actually building a relationship with the family and finding out what was happening for that child. And a background image for this is that people have for many decades been thinking that they have a beautiful policy. I mean, the government thought it had beautiful software for a very long time, and it was the workers' fault that they couldn't use it properly. So you end up with this image that everything at the top is fine. It's at the front line that you've got the problems, and it's the workers who are to blame. So you end up trying to control them more and more and make the problem even worse. And the alternative image that I think is essential is that it's the workers who create the solutions. It's the workers who are able to help a family look at their problems. They help to motivate them to try and change, or they can realize the child is in too much danger and take them elsewhere. But it's the workers who do the real work that actually makes children safer and makes their future welfare turn out better. And so instead of them complying with procedures, you need to tilt the way you think so that you're looking at how can our procedures help them work better, not how can we make them comply with what we tell them to do better. So looking at the kind of expertise, there's the formal knowledge, there's obviously knowledge of law, there's some research from evidence-based practice theories of human behaviour, the sort of stuff you can learn on a formal course. But even more importantly, I think, is the reasoning skills, the ability to look at the evidence and say, well, I believe that person but not that person, or I could test what that person says by asking the school teacher. We have some terrible cases in England where the social worker has believed the parent who says, no, I haven't been abusing my child. And that isn't a good enough source of evidence. You do need to look elsewhere. And in making decisions when, you're trying to decide what's best for the child's future, but obviously you can't know exactly what's happening. And for most of the children that we work with, their futures are not going to be very, very rosy anyway. You're looking often at which is the least harmful option. How can we maximize their welfare? But there is danger in all the options. If you remove them, there's danger in the alternative care you provide. And if you leave them, the family, even if at the moment they look mildly dysfunctional, can have a crisis and become severely dysfunctional without much warning. And they also need supervision to help them with that reasoning. To me, supervision isn't a nice thing to do if you've got time. It's absolutely basic for improving the quality of work, because the worker gets so pulled into the dynamics of the family. It's very hard for them on their own to stand back and make a formal review of their judgments. So another dimension of expertise, which I think has been very undervalued by the English focus on management and procedures and rules, is the crucial role of intuition and emotions. When you're with a family, it's your intuitive knowledge that helps you follow the emotional flow of the interview, of knowing how to phrase difficult questions, of how to challenge, of how to notice what they're avoiding saying, picking up the patterns. It's not one individual thing that worries you, it's the overall pattern of the way a child is treated. So that the skills around the relationship, where you are using your intuitive knowledge and emotions in order to gain a degree of trust, to show them that you are genuinely concerned for them and that you are listening carefully to them. One of the big complaints we get from parents is the sense that the worker was only looking for our problems and wasn't willing to acknowledge that we also had strengths. And families, like most of us, are a mixture of good and bad, and we need to be aware of their strengths, because that's often where you can build to make the environment safer for the child. The third issue there is emotional wisdom, which is being able to handle the very strong emotions in the work that we're dealing with. If you are seen as someone who's threatening to remove a child from a parent, you do arouse very deep feelings. I know if anyone had threatened to take away any of my children, I could well have felt pretty murderous in wanting to protect my children. So you are dealing with the most intense feelings of human life in terms of the relationship between children and parents. And that's got an emotional cost to you. So actually being able to talk about that back in the office, being able to get comfort when it's been very traumatic, is really important in order for you to be able to be sensitive to the next family that you go and see. You will also get pulled into family dynamics. You will start to get, for instance, a very vivid sense of how well-meaning the mother is. And while you're there, you may well forget to then think that, yes, she's very well-meaning, but is this child getting any decent care or not. And often it's back in the office with the supervisor that you're able to see how your views got a bit skewed by the emotions. And then we want the people working with families to develop expertise, and time is one of the factors that is important. In England we have too much of a pattern of people becoming a child protection worker for 2 or 3 years and then moving on to something else, and that really isn't long enough to develop the kind of skills that are needed. But experience on its own isn't good enough. You have to actually stop and think about your work. Again, supervision helps you do that, but if you just rush from one task to another, you don't get any wiser, you just get tired. And the other thing for learning is some feedback about what happened later. You know, if you've made an assessment about a child's safety but never learn whether it turned out to be accurate or not, you don't know whether your decision making was good or bad. So all three of those things are important. And then the fourth thing that is also important is that the organisation values the development of expertise, because then they will put the other things in place. They will make sure you have time for thinking and make sure you find out what's happened to the cases that you've done. Another factor which is very important within the English context, and I don't know how much it applies elsewhere, is the need to try and get away from a blame culture to a just culture, that you're making decisions about children on the basis of what's likely to be the best option for them. But bad outcomes can happen, and it doesn't imply bad practice. You know, a family can have made huge progress and the parents could be functioning very well, and then events happen and it knocks them back, and the father goes out and gets drunk and becomes very violent again. These are very low probability events perhaps, but a low probability event can happen. It's a big issue within England because we have a very punitive social culture in terms of the newspapers run really offensive, vitriolic campaigns when there's a high-profile case of a child being killed by a parent. And over the decades, that has led to a highly defensive culture, which has contributed to people putting the focus on keeping the records up to date because they're covering their back. In the event of a child dying, you can show that you completed the right forms, that you held the right meetings, but you may not, of course, have developed a good understanding of the family or made wise decisions, but the focus on the record can obscure that a little. But one of the things that I think is really important to remember is that when you have defensive practice by practitioners, it doesn't avoid risk, but it does displace it, and that's usually onto the children and families. So we can end up where people's priority is to protect themselves or their agency over protecting the child, and they will take actions which they don't think are in the best interest of the child, but look more defensible because they're the official thing to do at that time. We can have rules that are, or principles that are treated as rules, that something that is probably a wise thing to do in a large number of cases isn't the right thing to do in some cases, because human scenarios are so varied, and we need to be able to say, no, this child, it's different, we've got to make a different decision here. So finally, to look at the organisational climate and how that influences them. It makes a very big difference to how the workforce experience their jobs, and it's clear from research that it then makes a very big difference to the quality of help received by children and their families. And the kind of factors that help are when workers feel they're able to offer personalised care, that they're not going out with a one-size-fits-all standard response that they have to squeeze the family into. When workers feel that they've got time to build a relationship with service users so that they are getting a better understanding of what's going on and are able to treat them with respect. A culture that is looking more at what's happened to the child and have we helped them rather than have you completed your forms on time, which is where the English system had ended up, that people could describe good practice entirely in terms of processes in the service rather than any effect on the child. It also helps if people have role clarity. and that they have a fair culture rather than a defensive culture where they're scared of being blamed all the time, and a culture that allows them to cooperate with others, that doesn't expect them alone to handle the stresses of the job. And then the things that hinder it, process-oriented management, also having too heavy a workload so you never feel proud of what you're doing. Conflicting messages, which are very common in terms of the official policy and then the unofficial cultural message that you get. I mean, in England, the classic conflict is between the pressure within the organisation to comply with the performance indicators, but knowing that the director would always say in public, of course, the priority is the child's well-being. But when it comes, to giving them that sort of conflicting message is extremely damaging. And then emotional exhaustion. If they haven't had the support from the organisation in dealing with the nature of the work, they will get exhausted and burnt out. Organisations, instead of the focus on checking compliance with procedures, need to get much more focused on getting feedback from users about what was happening to them, getting feedback from the front line about what's working well or what's difficult, and having the ability to do, I think probably you're familiar with single loop and double loop learning. Single loop learning is just trying to do the same thing in the same way more accurately, but double loop is standing back and thinking, is this the right way to go about it? And having that ability to reorganize and change in the light of what you're getting as feedback is really important. And in England, people have got very keen on peer review because it's they feel that they are friends. They're willing to be more honest and open with them than with a more formal inspector. And so I've ended with some references of stuff that I have quoted within that presentation. But I will stop there. Thank you.
Okay, this is period where you can write questions in the chat window for Eileen, and we'll probably have time for 2 or 3 questions, or maybe a bit more. And if some of you feel that your microphone is working well, you can raise your hand and we can call on you. But that's where we'll go ahead and start. So. And somebody asked if we can put the references back, and we will do that right now. In the meantime, if you have questions, please put them in the chat box. And maybe I'll start, Eileen, with a question. You have 3 or 4 different slides about the way the organization needs to work to provide a supportive climate for practitioners. And I was wondering what you saw as the role of the supervisor in helping either promoting some of these practices or hindering some of these practices. In particular, you talked about an organization that values the development of expertise. What role might a supervisor play in that? Or providing a kind of a fair culture, what role might the supervisor play in that? So maybe you could start with that question, and then we'll take some from the box after that. You want to go ahead, Eileen? You could press your talk button again.
Right, I was actually typing an answer. I've forgotten that that's what I meant to do. Yes, talk. I think the supervisor alone isn't able to do much unless the wider organisation supports them in their work. I think there has been, to me, in the literature, too simplistic an idea that we can dump everything on the supervisor. I think the supervisor should get the same kind of organisational support from their managers that they want to pass on to others. Supervisors are not superhuman. So just moving the place where we actually think this person can handle the intensity of this work from the frontline worker to the supervisor, to me, isn't a good enough solution. It is about the whole organisation knowing that that's what we deal with. One of the recommendations I didn't make but was very tempted to make was that the director of the service should spend half a day on duty every month just to remind themselves why the work was difficult.
That's a good idea. probably a good idea in lots of different places where supervisors should spend more time actually trying the work. We had a question that came in. First question was kind of thanking you for your presentation and saying that you referred to the practice of treating children, and the question was, is that because that's your primary background, or is it the primary focus of social services in the UK?
By treating them, I didn't necessarily mean therapeutic treatment, but of the way that you talk to them, the way that you relate to them, how they experience your contact was what I was referring to. Because our aim is to make their lives better, whether it's through direct offering of therapeutic help or whether it's through helping them engage with other services. But I think on the whole, when I talked about that, I was meaning just the actual way that you related to them in the course of a child protection investigation. That's assuming that you talk to the child as you should do according to the Convention on the Rights of the Child.
As you're thinking about it, I mean, there was a comment that came in from Adriana Davis, which I think was basically, if I understand the comment right, reinforcing the point you were making about results-oriented versus process-oriented, and that she said in her perspective that this has led to more of a focus on performance tied to simplistic quantitative or time-related measures with quality of services and time directly engaged with families, clients, or projects sacrificed. It was more of a culture rushing from bureaucratic task to task in a CYA rather than meaningful case or project management. So just a comment, but if you have any further thoughts about that, maybe you could add to that at this point.
I think there's a problem of not being able to document that the time spent. You know, if you spend twice as long on a home visit because you are building up the trust of the mother so that she can talk about the family violence more accurately and honestly, then you know, to an accountant looking at the use of money, you may look rather inefficient. You know, if they're looking at things purely in terms of how many cases have you processed through the system and how quickly, then the quality does get overlooked. And I think it's up to professionals to actually be noisier about demanding the conditions in which they can have self-respect, that they are working ethically and effectively with families.
Okay, thank you for that. I mean, it is a difficult issue, this whole issue of kind of documenting and measuring something as complicated as the processes that you're describing. And in some ways linked to this or slightly related was a question from Lily Brent that was just in the box here, and that's, do you see any positive role for forms or standardization, even if it has gone too far in some places? Are there ways to make tools and guidelines that boost worker capabilities rather than obscure their flexibility and their ability to respond to individuals? So what role can perhaps that kind of documentation play if we were to look at the other side of the ledger rather than seeing it as something that's driving people to look at the wrong things?
I think there's masses of potential for forms and some standardization to be positive. I mean, I think all of the reforms that introduced those things were done by intelligent people with good intentions. It's about the proportion, and also when you put them into a defensive culture, then people can take, you could give guidance that is saying that these are the principles to bear in mind as you work, but you know, apply them to each particular case and decide how they fit. But when you have a defensive culture and a very inexperienced worker, they tend to turn what should be a piece of guidance into a simple rule. And we have workers who will say, for instance, with adoption, there is a principle that getting a good ethnic match is important, but some people turn that into a simple, anything is better than placing them with a parent who isn't of the same ethnic group. So, when the anything is actually leaving them in a very poor quality residential care, and that's what they know is the alternative, then they should be actually seriously questioning that. So I think my instinct is to like reforms and guidance. It is the way, it's the amount that they have, and also the need to study how they actually impact on performance, rather than assuming that because they're a well-designed form they must improve practice unless you've got idiotic workers. You need to look at whether they have unintended effects when you try to use them and are not as good as you'd hoped.
Okay, thanks for that. I have another question, because you referred to an organizations that have defensive cultures and the kind of negative impact that a defensive culture can have. Many of us kind of work either in organizations that may have defensive cultures, or we're trying to provide assistance of some sort or technical assistance to organizations that have defensive cultures. And I'm curious, from your work, what might be one or two key actions or interventions that either somebody working inside an organization, or for those of us working outside that are trying to work with organizations, could make to reduce the defensiveness and to make it into a more supportive organizational culture. I realize it's a big question, but I thought I would see what you thought.
Right. Well, in England, and I think in several other developed, well, in North America and Australia, I think there is a lot of the defensiveness comes from the reaction to a child death. And if the people, we had one really horrific death, and the instant reaction of our Secretary of State for Education was to blame the worker and to sack the Director of Children's Services. As a first reflex, this is highly destructive, that it creates a really frightened culture out there. If you have a politician who instead will say, this is a terrible outcome, we will look at the quality of help given and see whether there were any problems, but you don't prejudge it, because it could be that there'd been excellent work and that other events had occurred that you hadn't been able to predict and had led to this outcome. So I think you have to have a better understanding of how difficult the work is at the political level and the senior management level. And so educating them is one strategy to how you can start to shift it.
Good. Then why don't we take one last question here, then we'll move on to the next one. But it just came in. It said, from Minaka J. Cody, I probably butchered that name, but could you please discuss how supervisors could potentially observe workers and give comments on practice and support in the quality of the interaction with the children and families?
Yep, it's quite simple. You go out and do the visits with them. I would like to see a lot more joint working, both for getting more understanding of the family, because there's two of you working with them, but also of that mutual support and challenge that you can give each other. But it is, nowadays in England, we have an inspection process, and the inspectors will now actually go out to observe practice directly instead of just looking at the computer records, because it's another dimension on work to see that. It's, you create an overall judgment by looking at several different sources of information. But I think observing people it was certainly a major part of my development, of either co-working or being interviewing families in front of a one-way mirror and getting feedback that way. But helping people be public about what they're doing, be observed and talk about it, is a really important strand of developing expertise.
Okay, thanks for that. I would also imagine that there's a sort of parallel skill on the part of the supervisor, not only to go out and observe, but then to be able to discuss what that supervisor observed with the worker in a way that is not either punitive or negative. I think there's a skill set involved in that and some competencies involved in it. That so both of those come hand in hand. It's getting out more, doing what you were calling mutual work, but doing it in a way with mutual respect and so on.
Yes, I mean that sense of mutual respect as you talk about it is so important, or the next time they'll clam up and not listening to you. People become highly defensive if you just throw insults at them.
Yes, that's true. Okay, we'll have a chance for us to, if there are further questions about this in the second discussion session, but we're going to go ahead and move on to the next presentation. And as you remember, this is a presentation from Rita Mayumbo, and as Amy mentioned.
Okay, everybody, there's a little bit of a, I think, bandwidth drop for Jim. I think what he's going to do is he's going to log back into the meeting, and so he'll pick up where he left off shortly. So we're just going to wait a moment for Jim to log back in, and then we will resume. So I could see that his internet connectivity had dropped. So he'll be joining us again shortly.
Small interruption there in the service. I think that Rita's still on, so Rita, why don't you turn your microphone on and you can begin your presentation.
Okay, thank you, Jim. It's a privilege for me to share with you the work that we've done around strengthening the social service workforce in South Africa. It was interesting to see that Dr. Monroe's presentation touched on a lot of issues that we deal with in our skills development programs. And so in this presentation, I will share with you what we've learned around capacity building with specific reference to community caregivers. The quotation that you see basically summarizes the impact that participants have experienced through this capacity building program. Thogomelo Project is a 5-year pilot that is funded by USAID under AIDSA. Thogomelo itself means to care in Venda, one of the 11 languages of South Africa. It's being implemented by 3 partners, PATH being the prime, HGA and the International HIV and AIDS Alliance as implementers. The project resides within the Department of Social Development, and it aims to strengthen South Africa's care for its caregivers and protect vulnerable children, ultimately improving the quality of care of children. We believe that a well-cared-for community caregiver is an effective one. So who is this community caregiver in the South African context? This is someone who provides different services to vulnerable children in communities and is associated with an NGO, FBO, or CBO. She or he receives a stipend from the government. Within our project, we have an imaginary character who started off as a caregiver and became a supervisor. She can be identified by all our participants during the training, and I would like you to meet Google. She is mainly female, aged between 26 and 40. Most of the time she's single and receives a stipend of about 1,000 rands. She has many stresses that include being overworked and receiving limited support from the organization and those around her. She experiences a lot of stigma, and the boundaries at work are not very clear. She also lacks skills and knowledge on how to respond to children. She visits 4 to 6 households a day, 4 to 5 times a month, and the majority of the beneficiaries are girls. She supports these children to access grants, food, education, health, and looks after their well-being. So why should community caregivers matter in the social service workforce? This is because they play a unique role in that they are in the front line of services to children. They provide services in face of shortage of social workers and associated professions. They have immediate access to rural, under-resourced communities. And in many cases, they're the only available advocates of children's rights in the face of systematic failure of the police and courts. Therefore, it is critical and imperative that we build the skills, increase the knowledge and abilities of these caregivers, and also improve their well-being. Thogomelo developed 3 accredited curricula in response to this need. The first curricula was on psychosocial support for caregivers. The second one was on child protection for supervisors of caregivers. And the third one is on supportive supervision for caregivers of for supervisors of caregivers. And in this presentation, we're mainly going to focus on the supportive supervision. Through literature reviews and focus group discussions that we've conducted with our participants before the development of this curricula, it was evident that there was little or no supervision in organizations. And if there was any supervision, it mainly focused on task versus process and the well-being of the caregiver. There was also lack of supervisory skills. We had trained community caregivers without empowering supervisors, and this became a futile exercise. It was therefore critical for us to try and enhance the effectiveness and sustainability of the work that is done by caregivers, and also empower supervisors to create caring environments in their organizations that prioritize the well-being of caregivers, hence the development of the Supportive Supervision Skills Development Program. There are 4 main aims that we try to address in this program. Firstly, is to strengthen supervisors' own psychosocial well-being. Secondly, to understand the psychosocial stressors of their caregivers. Thirdly, help them understand the different models of supervision and how to bring psychosocial well-being into supervision. And lastly, build, manage, and sustain practical psychosocial support systems and practices in their organizations. So who is the supervisor who has participated in our program? This could be an experienced caregiver or qualified professional who can offer knowledge, skills, and provide practical advice to caregivers. They have an opportunity to create space within supervision for psychosocial care and support. They are also able to build a caring organizational culture in the workplace where all caregivers feel supported and safe. This curricula is based on 3 modules, and the first module, that is on psychosocial well-being and self-care, mainly focuses on understanding the well-being of the supervisor and their caregivers, the stress and stressors that they encounter, and any self-care strategies that they can adopt in their organizations. Module 2, which is quite critical, is on supportive supervision. It mainly focuses on supervision, understanding supervision, looking at the different models that are in the organization. This could include individual, group supervision, internal, external supervision, peer supervision, mentoring, and coaching. It also looks at the skills that they can adopt to help them within their supervision. It also promotes a stronger psychosocial support focus in supervision. Module 3, which is on creating a caring organization, mainly focuses on creating a caring environment that promotes well-being. It also encourages building strategic partnerships and the development of strong referral networks. Our training cycle is divided into classroom and workplace implementation. The classroom training is broken down into 3 blocks, where participants receive a learner manual, learner workbooks, write knowledge questionnaires, and they also receive study guides. Then there's the field work, where they go back into their workplaces for 2 months, where they are actually practicing what they've learned in the classroom. And at the end of the field work, they are asked to present an individual program presentation based on what they have implemented in their organizations. During all the training, they're encouraged to fill in a portfolio of evidence. And this portfolio of evidence comprises of the learner workbooks, the knowledge questionnaires, the practical workbooks, including the program presentation. The portfolio of evidence is assessed by an assessor and moderated by an external moderator. The POE is then taken to a quality assurer, which is health and welfare SETA, to verify those portfolios. If the participants are found competent, the results are endorsed. We emphasize that the training be conducted by an experienced facilitator, that is someone who understands supervision, adult methodologies, and focus on experiential learning. We do not prescribe a type of supervision, but we assist participants to identify a model that works for them, and we try and build on that during facilitation. A question most of you might be asking at this point in time is, have you seen any impact? Our evidence base is based on a couple of surveys that include a baseline and follow-up study, a pre- and post-test survey, a psychosocial well-being survey, and qualitative focus group discussions. So far, we've trained 132 supervisors. There were 12 dropouts. And of the 120 that have completed, 101 were females. Regarding impact, we view it on different levels, starting from individual, where we look at what has changed in their personal lives. Supervisors have reported a lot of change in their personal lives with regard to self-care and self-awareness. On family level, they've reported how there are still changes in how they interact with their families. And on work level, they've also reported that they have actually created caring environments and environments that are friendlier to everyone in the organization. And on community level, some of the supervisors have reported that they have developed effective referral networks that are actually working for them. The following are some of the quotations that we believe indicate the impact that the project has had on supervisors. And during these quotations, we're mainly focusing on the different modules. And on module 1, looking at the supervisor's well-being, one of the supervisors said, "I didn't know how to set boundaries. I couldn't say no. I'd forgotten about me and my family. I'd like the others to also go on this training." And the other one said, "We are now dealing with stress instead of letting it take us over." Focusing on module 2, one of the critical and most important modules, we conducted focus group discussions with caregivers whose supervisors had been on this training, and they had this to say: "Our supervisor has really implemented supportive supervision. Every Tuesday, we are having these meetings, and they are for stress relief. She does planning for supportive supervision, and she's making it part of her programs." And the other one said that now after this training, it's like he has learned to respect us. He really has changed, even in his way of approaching a person. Supervisors have tried to create spaces where caregivers feel supported, comforted, understood, and looked after. This is what they had to say. The whole organization is becoming more aware of self-care. You know, we are saying in our organization, whenever someone does something to look after themselves, we all say self-care, and then we all laugh. And another supervisor said, it is better in our organizations now because we have mutual respect between us and the caregivers. And so, what is the value of Thogomelo training? It strives to strengthen existing structures by building on what is working well, especially using locally appropriate approaches. It encourages solution-focused approaches using appreciative inquiry. It promotes internal models of supervision in contexts where external models are not easily accessible. By internal, I mean a supervisor who is employed by the organization, and external might mean a social worker coming from outside to do the supervision. It supports career development in a context where people's vision of what is possible for their lives is often limited. It focuses on personal development and self-care of the supervisor using positive approaches that do not cost money. And it provides entry-level service into the continuum of social services, advancing opportunities for the previously unrecognized, unregulated category of caregivers. We have had many challenges in implementing this project, stemming from lack of buy-in from management of the organizations we're working with, limited support from government for those organizations who are funded by the government, a lack of proper supervision from untrained managers, and sometimes the trained supervisors move to better jobs. However, the training has promoted a sense of well-being amongst caregivers. It presents opportunities to embed project sustainability through transfer of skills to government officials for quality assurance. It also presents opportunities for us to directly contribute to the strengthening of social service workforce, not only in South Africa but globally, and not only amongst caregivers, but for all who work in the social services. Thank you. I'll end here.
Okay, thank you very much, Rita. That was really good, very interesting. Again, we went from Eileen's sort of overall talk about organizations and organizational culture and how it supports performance, and then what's the role of supervision in this to a kind of a really good example of supervision and training of supervisors and peer supervision and so on, and what that looks like. So what I'm going to do, again, continue to write your questions, and we'll have a chance to ask Rita some specific questions. You know, I might start, Rita, with just a question of clarification, and that was about the training itself. You talked about that there are 3 blocks of training, and one question might be how many days of training, classroom training, is in a block of training, and then what's the sequence between the block of training and the field work? So just as a clarification question, let's start with that one. You can click on your microphone and answer it.
All right, thank you. The classroom training is comprised of 9 days, where they are in class for 5 days, the initial 5 days, where they go through the 3 modules. They are then go back into the field for 1 month to 6 weeks. They implement what they've learned. They come back for 2 days. They brainstorm, mainly to brainstorm on what has gone well, what has been difficult when they try to implement a supervision model, when they try to make sure that there is a better environment for the caregivers to work in. They discuss that with others because it's all experiential, it's all discussions with other supervisors, and it's all to do with what really works for them in their environment. So after those 2 days, they go back into the field. They are there for another month to 6 weeks, and when they come back, that's when they actually make a proper presentation to everybody in terms of what they've implemented and whether they've gotten any support from management in terms of making sure that there is a model that they can follow and there is some psychosocial support program of some kind. So that's how it's broken. This is about 25 credits for those who know the South African context. That translates to about 250 notional hours. And we encourage that for all our programs, it has to be 30% classroom and 70% mainly in the field.
Very clear response to that, and a really good example of this sort of interrelationship between classroom experiential training and field work and back and forth and the relationship between them. So thanks very much for this. Another question came in from our UNICEF Lesotho group, our person, and that is, what's the structural link between the project and the Ministry of Social Development? Is there an official commitment from the ministry to the project? Is it founded on an MOU or any other binding document? And how is the payment of the 1,000 Rand stipend justified? So some questions about that.
When the project was developed, and it was forming understanding that after the 5-year period where we were piloting the program, we would give it to the Department of Social Development. So at the end of it, when we finish after the 5 years, we are going to give this project to the department to run. And we have been building capacity within the department for them to be able to take over the program after the project. So there is an understanding that after the 5-year period, we will give it to the Department of Social Development. That was a USAID stipulation. So every month we've got a meeting that where we include USAID, all the other stakeholders who might be involved in the program, including the Department of Social Development, where we look at how we're going to hand over the project to them. Regarding the 1,000 Rand stipend, those are organizations that are being funded directly by the department, and I'm not so sure how they decided on 1,000 Rand, but most of the caregivers just receive 1,000 Rand as a stipend, and they don't call it a salary because it's just something to help them when they go in the field.
Okay, thank you, Rita. And it's somewhat related. This is from Amuru, what is the link or relationship between your approach or this model and the Isibindi model?
Interesting. We have been trying to actually link up with Isibindi model because with the Thogomelo Project, what we wanted to do was to create a career path for community caregivers. Somebody who goes into the Isibindi model, they have to be able to read and write. They have to be able to go through their learning process and get the credits and the qualification for it. We have been trying to actually make it a point that everyone who goes on the Thogomelo Project, that becomes a foundation for them to get onto the Isibindi model, or into child and youth care work, or into social auxiliary work. So trying to create a career path for them. The discussions are still on the table. We're working very closely with the Department of Social Development because they work very closely with Isibindi model. We're also trying to make sure that anyone who goes through the Thogomelo Project, it's not just perhaps the Isibindi model, but it's a stepping stone for them to get into the Department of Labor, to also get involved into the expanded public works within South Africa.
Good, thank you for that response. On another subject, a question about the peer supervision. Can you say a bit more about that? You know, what does it look like? How is it received? And do some supervisors then return to their organizations and implement this? But just a bit more on the peer supervision.
We do discuss a lot when we do our training on peer supervision, and when we talk about the advantages of it and the disadvantages, and mainly the advantages being that people may feel more comfortable talking about issues with their peers, those that they believe can understand them, and so we do encourage the peer supervision. There's also often a sense of resonance and relief at hearing that others are dealing with similar work situations. Peers can often offer hands-on advice and support because of their experience with similar situations and the familiarity with the context that they work in. But there have also been quite a number of disadvantages where we found that it is often difficult to find or make time to meet regularly. So peer supervision tends to get postponed when work gets busy. Peer supporters also can get swept up in strong emotional reactions without the support of someone less personally affected by the situation. So in terms of the report back from supervisors and those who have gone and tried to implement some type of supervision, peer supervision hasn't come up a lot as something that they've implemented. We're not sure whether it's because they do not like it or whether they don't understand it, because we haven't gone through all their workbooks to actually see whether they've tried it and it didn't work. But we certainly encourage it, because when they are in the training, we encourage them to create support groups during the training. When they go back into their organizations, most of them have retained those support groups. And those support groups also work as peer supervision for themselves to see whether they are doing something correctly, whether they need to bounce off certain ideas of other people. So with peer supervision, it hasn't really taken off in terms of it's a model that they actually they can take on. And there might be various reasons why that hasn't taken off.
Yeah, thank you much for that response. Another question that's somewhat related, and you've talked a little bit about it, but there was a question that came that said, how much are the supervisors paid, and are they government employees?
Sorry, Jim, I didn't hear the last part of your question.
Sure. How much are the supervisors paid, and are they government employees?
The supervisors are paid, just a little bit above the 1,000 rands, because in different provinces, supervisors are defined differently. You'll find that in other provinces they are called coordinators, in other provinces they are managers. In other provinces, supervisors are the ones who started the organization, so they're sort of the directors. So in terms of payment, it ranges from perhaps just being a supervisor and they pay the same as the caregiver, to slightly above 1,000 rands to about 2,000 rands. For those who started the organizations, probably they pay themselves more. So the other determining factor as well is the structure of the organizations in most provinces. For example, there is one province where all caregivers are now being paid directly by the government. They are no longer being paid through an organization. And therefore it means their salaries or their stipends go through the government. Whereas in other provinces, the salaries are paid by the organization. The organization receives money from the government, and then they give it to the caregivers. So in those sort of organizations, the payments might also differ, but you will find that supervisors are not paid much more than the caregiver, depending on whether they're a manager, a coordinator, or perhaps they started that organization.
Okay, Thank you, Rita. One other sort of related question to this, and that's to the degree that you have data or information about this, what has been the supervisor's experience when they go back to their organizations in terms of support from the management of the new or from their organizations to implement the model that you've designed?
Let me start from the beginning when we developed the psychosocial support for caregivers. We expected the caregivers to go back into their organization and implement the psychosocial support program. When the caregivers went back into the organizations, they were blocked. They could not implement any programs. They could not, some of them could not even share what they had learned, because when they went back, they felt very important. They knew more than the supervisors. They said, well, we need this, we need that, and it didn't really work very well. So when we started training the supervisors and they went back into the organizations, it was much easier for those who had their community caregivers trained on psychosocial support for them to get support and lobby the management to say we need this in our organization. So the integration of the supportive supervision and the psychosocial support for caregivers worked very, very, very well. And in hindsight, we should have started with the supportive supervision so that we build the capacity of the supervisors, and then for caregivers, for them to work together in creating that environment and embedding and sustaining the practices they've learned in the program. However, some of the supervisors, they found it quite difficult to convince their management that they needed time to provide for psychosocial support. In the norms and standards for the Department of Social Development, they encourage and would like to see a psychosocial support program in each organization. And we are lobbying the department when they do their quality assurance and quality visits for them to also put a little bit of pressure in there when they monitor that there is actually a psychosocial support program on the ground that has been implemented. That way, the supervisors are likely to be able to implement something. But so far, we haven't had too much resistance in terms of actually implementing some sort of program, because it's possible that the management has seen that there are advantages in actually having a psychosocial support program, because most of them do something on a Friday, and they've seen how the caregivers actually look forward to a Friday. And that's their own time. That is when they can do what they want. That is when they can actually download. That is when they can be creative in the organization. So the integration of the supportive supervision, the psychosocial support is assisted in terms of actually lobbying for a program to be implemented in an organization.
Okay, Rita, thank you very much for that, and thanks for addressing the questions. And I think what we'll do now is maybe open it up for more general questions or discussion on either presentation or from examples from any of the people that are participating in the webinar. The general discussion is, we want to hear more about efforts to create supportive work environments for social service workers in your countries, and what have been the successes and challenges. And in particular, we might be interested, since this last presentation was about supervisors and supervisory training and supportive supervision, whether any of you are in fact training for supportive supervision. So you could respond as a participant in two ways. One is you could, if your microphone is working, raise your hand and we will give you the mic, or you can write in your box, in the chat box, and we'll see what people have to say. So either, what kinds of work are you doing within your program in your country around supportive work environments, and in particular anything that would be helpful for people to hear around supportive supervision. Or as people are thinking about this general question, if you have any further questions or observations about either Eileen or Rita's presentation, you can also include that in the chat box at this point. Rita, we did have another question that came in from Adriana Davis in the DRC. How are community caregivers selected, and how are the supervisors or peer supervisors selected? So questions about selection of both the CCGs and the supervisors.
We have a selection criteria that we've drafted that was given to the Department of Social Development, because at the moment they have been the one who's been providing us with the organizations that we have to train. We've also trained tech partners, and we just give them the selection criteria. And for community care, for anyone who wants to come onto the program, because it's an accredited program, we would require that perhaps they should be able to read and write, because their portfolios have to be moderated and something has to be written down. However, we are developing guidelines in terms of how to do recognition of prior learning for those who would like to progress and do the work on their own, and also doing oral verbal assessment for those who cannot read and write. It's quite an intensive process in terms of actually taking through somebody who cannot read and write, but recognizing that in South Africa the educational level is very, very low, and we've actually discriminated against a lot of those caregivers who have been in the field for the past 40 years or so. So we're trying to actually make sure that our selection criteria will include those who have been left behind in terms of actually gaining something through this program.
Okay, thanks, Rita. I think we had another comment or question that came in as you were giving that question, and that is, you know, some of these challenges that we've been facing in our experience have been the acknowledgement of caregivers as an integral part of the social service workforce, and to be paid as such by the government or from the government through NGOs. So having an enabling policy environment would be a big step for us. I know, what country is that? Could you type in the country that comment came from? And as you're doing that, Rita, do you have any comment on that particular question or comment?
I completely agree with you in terms of actually having that enabling policy, and what we're actually trying to do at the moment is to develop an evidence base that might be able to influence policy in terms of actually making sure that caregivers become an integral part of the social service workforce. We are talking to Health and Welfare SETA in terms of actually creating a caregiver qualification, and so that community caregivers can be recognized, can have the qualification and recognition of the work that they're actually doing. It will be it's still a long way off, but we've been trying really hard to make sure that happens. We're also trying to make sure that community caregiving becomes part of the human resource development within the Department of Social Development, so that there is some sort of recognition for that work, and I completely agree with you, we need that policy.
Okay, thank you, Rita. Now, as we heard from Eileen, and we heard some questions to Eileen, and we've heard from Rita, and questions and back and forth and discussion. But I did want to give Eileen an opportunity to either ask a question that you might have on your mind, or to comment on any of the questions that have come in since your presentation or on Rita's presentation. So Eileen, do you have any further thoughts you want to add at this point?
You've taken me by surprise there, so I hadn't prepared something to say. I'm really impressed that Rita is talking about developing the support for workers as a sort of an integral part of developing the service, rather than it being an add-on at a later stage. Because I think otherwise you get burnt out workers who aren't developing skills. It's not cost effective to stint on providing the right kind of organisational support. But I can't think of anything else that will add to the discussion at the moment.
Okay, thank you, Eileen. We had another question that came in, and Rita, I think this was more directed at you. And the question was, we also have some of these challenges in the DRC and would be interested to learn of adaptive tools to include community caregivers with low or no literacy levels. So you mentioned that, Rita, before, but could you say a little bit more about that?
Thank you for that, Adriana. Yes, I think the main tool that we're looking at here is combining recognition of prior learning, that is what they've done in the field, recognizing that they've been in the field for a long time, they know. I mean, when you talk psychosocial support, it has been done. It's just that when you say psychosocial support, when you say depression, when you talk about grief and bereavement, it's something that they've not really verbalized. It's something that they think it's quite big, but when it comes to the basics, it's something that they've been dealing with on a daily basis. So recognizing that, yes, they've done this work and they need some recognition, they need to know or have some sort of certificate is very important. So we're combining that recognition of what they've done and then combining it with oral or verbal assessments where we actually take them through by asking them questions. They respond, somebody writes down. We're also exploring perhaps the use of the mobile phone, because all our 99% of our caregivers have got a cell phone, and we might as well use it when they go to do certain interviews. It would be good if they can actually record it and provide it as proof when the quality assurer comes to say, I did this interview, I did make a presentation at my workplace, I cannot write it down, but here it is. So we are trying to look at innovative ways of how we can actually include those caregivers who've got low literacy. And I'll be happy to share with you as soon as we finalize the standard operating procedures. They're at the moment in draft form, but as soon as they're done, I will be, when we've piloted them and they're working, I wouldn't mind sharing that with you.
I think that would be very helpful, Rita. That was a very good response. I think there's a good deal of interest in community caregivers, their role, what qualifications and quotation marks they should have, and how you assess those. And I think some of your examples around kind of oral, I don't want to say testing, but oral assessments of it, and maybe even training that way, and the use of cell phones are good examples. So I think sharing the report once it's done, or the approach, would be very helpful. We had a question from the Côte d'Ivoire, and again, Rita, this may be more directed at you, and that is, how do you or ought you to engage government in order to include this process in the formal school curricula? It's a different kind of question, but would be interested in your opinion on this.
Very interesting question, Irene. As we are approaching the end of the program, we've been dealing with the Department of Social Development, and we are saying for the sustainability and scale up of the program, we need to expand it to the other departments, even the Department of Education, because teachers themselves are caregivers. They look after children, and they need these programs. So we are hoping that going forward we're going to start engaging extensively with the Department of Education in terms of them picking up the program.
How do you or ought you to engage government in order to include this process in the formal school curricula? It's a different kind of question, but would be interested in your opinion on this.
Very interesting question, Irene. As we are approaching the end of the program, we've been dealing with the Department of Social Development, and we scale up of the program. We need to expand it to the other departments, even the Department of Education, because teachers themselves are caregivers. They look after children, and they need these programs. So we are hoping that going forward we're going to start engaging extensively with the Department of Education in terms of them picking up the program, because we see so much relevance in how it can help teachers improve the environment that they're working. I mean, I don't know if you've been listening to South African news, which has made, you know, the South African news in terms of teachers wanting to go on strike because the environments they work in are not conducive, they don't have enough salaries and all those kinds of things. So with mainly looking at the psychosocial well-being and trying to improve it, it can only ultimately improve the way they work with children. So we're definitely looking at working with the Department of Education. We have started the discussions, but we're still waiting to see whether we can take them forward.
Hey, thank you very much, Rita. I think we have addressed most of the questions at this point, and I think what we'll do is just move towards a few closing remarks and then on to some both looks at resources and looks at the future. I'll make a few closing remarks. I thought these were both really, really interesting presentations, and the questions were stimulated further thoughts about this. You know, in particular, with the first presentation, with Eileen's presentation, just the importance of the organizational environment in how it either supports a positive work environment or it doesn't, and then the factors that help and hinder those to achieve a supportive organizational culture were very important and very interesting. A second one for me, a key message around this is when asked about how do you change a culture, an organizational culture, from being too defensive, there is a tendency on the part of leadership to blame workers. And obviously, if problems occur, there may be a fast reaction to say, well, a worker must have done something wrong. But clearly, we're dealing with a complex working environment, and to the degree that somebody blames the worker first, rather than looking and examining and listening and trying to figure out what happened, it can create a frightened and defensive workforce and a defensive culture. And I think that was a key message. And so how to work towards doing and creating a positive work environment and what the organization can do about that. And supervision as being a key link in promoting and supporting a positive organizational culture and its linkage between the organization as a whole and an individual worker. And the idea about mutual work, and that is supervisors getting out, observing, and then sharing observations with workers based on a concept of mutual respect. So to me, those were some key messages that came out of that first presentation. With Rita's very good example of a program in a particular area in South Africa, to me, it was key to understand the kind of relationship between the classroom learning, where there were and the field work. So there was 5 days, and then 4 to 6 weeks of field work, another 2 days where people got a chance to come back in and share their experience and learn from one another about this, and then go back for 4 to 6 weeks of field work, and then come back again and share their perspectives on what happened, what they tried, and how management supported that. So it was a very good kind of outline of an active, experience-based, blended learning program between the classroom and field work. And I think, secondly, from that, the importance of the module on supportive supervision, was sort of reinforced as this program has gone back on. And then a response, which I thought was very important, that last question was in essence a sustainability question, and that is, this was a project-based program, so how do we assure that it will go on? And I think that Rita's explanation around trying to expand the program to the government, specifically the Department of Education, or in other countries it may be other appropriate departments, but trying to, when we start with a project or an intervention or a program, of trying to get this very important supportive supervision idea out with community caregivers in this case is very key to looking at sustainability issues. So those are some observations that came to mind as I was listening to both presentations and looking at the questions that came up. So with that, I really have learned a lot from it, and this has been very good. I'm going to turn it over to Amy for some final remarks.
Wonderful. Thank you so much to Chris, who started us off with a great introduction, to Eileen and Rita and Jim, and all of you for this really interesting discussion. We just have a few reminders before we close the session. First, if there are any other events or opportunities that you would like to announce to the group, please do so by typing information into the chat room. For example, World Social Work Day is coming up on March 19th, and maybe some of you are planning events around that. Also, if you're not currently on our listserv and you're interested in joining it, please send an email to that address that's on the screen there at capacityplus.org. Also, a summary of this webinar will be available on www.ovcsupport.net, and if you would like to address or to access a recording or the PowerPoint for this session, please email that same address that appears on your screen there. For the past 7 webinars we've held, you can access all of the summaries and PowerPoints and a recording from each of those sessions at ovcsupport.net. Also, we hope that you'll join us for our next webinar. The topic will be professionalizing the social service workforce, the role of associations and councils. We will be discussing ways in which countries are regulating the practice of social work through licensing, as well as establishing associations for the professional development and continuing education of workers. If you have any case studies or research or lessons learned that you'd like to share on this topic, please be sure to get in touch with us at that same email address, swws.webinars@capacityplus.org. So I see that there is an announcement for the International Consortium for Social Development Conference that will be held in Kampala, Uganda in July 2013, and it's being sponsored by Simmons University School of Social Work in the U.S. Feel free to continue typing in any announcements, and let me just say again, thank you to everyone for joining us. Have a good rest of your day or evening, and goodbye to you all. Thanks so much.